Welcome back. I'm joined by Colin and Krystle as we delve into the concept of activity-based funding. It's a healthcare funding model, and let's continue that discussion. So, Krystle, I'm going to start with you. You've written extensively on this topic, especially as it relates about healthcare innovation in Quebec and in all obviously various parts of Canada. What do you think has held Canada back up until now in adopting ABF more broadly? And what do you think maybe contextually has changed now?
That's a really interesting question. So, I think when we talk about healthcare reform in any capacity, it's an extremely emotional thing for most people, and they get really, really attached to the idea of everything being publicly run and publicly delivered and a public system, which, is, like Colin said, one ideological position.
Hmm.
But healthcare reform in things like funding mechanisms, it's such a straightforward proposition, but it gets that same emotional attachment when we talk about healthcare. And it takes a lot of political will to push through that when people get really upset and really involved in the conversation when it's perhaps misattached when we're talking about things like funding mechanisms.
Yeah, people. It's a visceral Canadian emotional response, and we really love to treat our healthcare system as a golden calf. And I appreciate our healthcare system, but we need to look for areas of improvement where we do things well and where we can do things better. I always think that's a good approach to anything in life. Um, and Colin, but we do have a lot of critics who will argue that ABF may lead to cherry picking of patients, that they may prioritize, certain clinics will prioritize a more easier or less costly kind of procedure, and then they might avoid more of the chronic complex cases. How valid is this concern, and how would one avoid that kind of outcome?
Well, Tanya, I think it's important to take a stand back for a second and just think about health reform discussions in Canada. Whenever they come up, there's always critics who say, well, we can't do this because of X, Y, and Z. When you look at what we're talking about today, this different way of funding healthcare to really focus it around patients, um, countries with better performing healthcare systems do this. We were just in Japan. They do it extensively there. They do it in France. Last year, we went with one of Krystle's colleagues over to France to learn about how they do it. Their system performs better than us. So we know that it can be done. There are certainly cautions and things that you need to take into account, but other countries have already figured all this out. So when it comes to cherry picking, I mean, this claim, you can put things in the regulations to make sure that it's done appropriately so that people get the care they need, and that's what you ultimately find. I don't think this is going to solve all of our problems in healthcare, but I think it's a really big change that could help a lot. Could help make sure that more of the money that we spend on healthcare actually reaches services to patients instead of all kinds of other activities that hospitals and health regions can end up spending precious tax dollars on.
Right. Krystle, in Quebec, again, you've had written a lot about this, and we've had some reforms based on, say, like a market-based lens. What lessons, positive or negative, what can we take away from that experience in Quebec that the rest of Canada potentially could adopt?
Yeah, so Quebec started to experiment with patient based funding, which is a type of activity based funding, as far back as about 2004. But it wasn't really implemented in any meaningful way until about 2015. And so it started to be rolled out in sectors and covering certain types of procedures. So in 2015, it was applied to the radiation oncology sector.
Okay.
And by 2023, productivity in that sector increased by more than a quarter while bringing down costs 7%. So not only did, the productivity increase, but it was lowering costs at the same time. And then when we look at MRIs, so it was implemented in that area as well. Same thing, increased 22%, and the cost per procedure fell. And that's happened in the sectors that Quebec has already expanded into. And so by 2023, about 25% of hospital activity was funded by this form of activity-based funding. And the province is wanting to move to 100% by the 2027-2028 year. So it's really going for it. And it's taking the lead in this area across Canada, but from the lessons in countries like Colin mentioned that have been doing this for decades, for years. that, you don't need to reinvent the wheel. There are lessons to be learned, and, you do need to implement it very strategically and in a specific context. But there are lessons here that other provinces could follow from Quebec in this regard.
Okay, and I wanted to talk about what other provinces might be starting to do based on this model in just a few moments.